Um, so at the end of February, Boston held an international business conference that was attended by 175 people from all over the world. This kicked things off pretty early and pretty fast for Massachusetts. Experts say it accounts for anywhere from 20 to 40% of the state's entire first wave of cases. Throughout the month of March, the virus continued to spread, and on April 21st, we have the biggest peak. Around this time, they were ranked third in the entire country for cases and total deaths. So at this time, numbers were looking pretty grim. Minority communities were and continue to be hit especially hard. In fact, cases have been found to be 3 times as higher in these communities, and one reason for this, housing is often overcrowded. Boston's the 4th most densely populated area in the country. These members of these communities are also more likely to be essential workers, rely more heavily on public transportation. As you can see in the map of Boston, darker regions on the left have higher minority populations, and they match pretty well with the darker regions on the right where COVID's more prevalent. One city hit especially hard is Chelsea, which has the highest incidence of cases in the state, 3 times that of Boston, which is just across the Mystic River. It's extremely densely populated. Housing is extremely overcrowded and already very unsanitary for that reason. Often you'll find multiple families living in a single home. They also have a very large immigrant population, meaning that language barriers and fear of deportation for undocumented residents will further limit their access to treatment. So how has the government responded? Both experts and public opinion seem to agree that they've been very proactive and very clear in their communication. In fact, there's been a pretty healthy decline in numbers since the beginning of May. Governor Charlie Baker has been credited with a lot of these positive trends and actually received an approval rating of 81% for his response to the virus. A lot of people attribute the state's success to an early compliance with social distancing. Here's in mid-March, there's a pretty sharp uptick, and a lot of people credit Governor Baker as well as the mayor of Boston for really emphasizing how important it is for people to stay at home. He was also one of the first to implement a contact tracing program in the beginning of April. It's called the Community Tracing Collaborative. It's a pretty simple process. Basically, if you test positive, you'll be contacted, provided with resources to isolate. And then they then follow up with your close contacts, also helping them through their own quarantining process. They've actually budgeted a lot of money and resources for this program, and a lot of other states have modeled some of their own off of Massachusetts. The state has also been credited for their diligence in collecting and reporting data. The Public Health Department hosts a COVID-19 command center site, and this is a screen grab of their daily dashboard. It reports tons of different data, even zeroes in more closely on trends within certain demographics, correctional facilities, and nursing homes. This is the first of 30 pages in today's daily report. And as you can see, it provides kind of 6 key indicators to help the public gauge how well they're doing, how far along they are in the reopening process. Throughout the reports, you'll see the statement reopening will be driven by public health data. This is something that state officials have repeatedly stressed, and I think that this type of transparency and data-driven approach is definitely very reassuring in a time where misinformation is circulated extremely quickly and very easily. A lot of credit is also owed to the state's healthcare system. Massachusetts is a huge healthcare state. Boston, of course, home to many major medical institutions. They've been very proactive from the beginning, and competing establishments have made a great effort to collaborate. They've shared a lot of data and resources and really come together to make sure that statewide there's capacity for new patients. This is a picture of the Broad, the Broad Institute of MIT and Harvard. It's a research center, and it's been huge in the state's response. It reallocated a lot of resources to COVID testing specifically. So current state at the moment, things are a lot more stable. Government has received a lot of positive affirmation. There's been a few recent concerns with Labor Day weekend and college students neglecting to follow certain regulations. There are currently 6 in total deaths, 17 in total cases, but they are considered to be one of the states in the best shape at the moment.
Great job with that presentation, Melissa. Your slides were nicely laid out, great insights, and they're updated. And you stayed within your time, which is great.
Yeah,
Any questions for Melissa in Massachusetts?
That was impressive, very impressive.
So I was just looking, actually, kind of in response to the Florida versus New York. I don't want to say political debate, but anyways, I was just looking at the deaths per capita at the state level, and it looks like Massachusetts is 3rd. So it goes New Jersey is 180, New York is about 170, and then Massachusetts is 130. So it sounds like they're doing well, but did they have a lot of deaths early on?
Yeah, that was definitely very early on. I know their nursing homes was like over half of the deaths were in those facilities. But yeah, I think people largely attribute that to the extremely dense population and crowded housing. People can't isolate, and especially in communities with large immigrant populations, they're not as likely to seek.
All right.
Gotta guess. Hey, Baba.
Okay, you gotta go.
Sounds like Arik.
Yeah.
Baba, look what
He's so cute, man.
got flies.
That's very nice.
One thing that really stood out to me is the contrast between Florida and Massachusetts. So one issue that came up with Florida was lack of clear communication, whereas in Massachusetts, the strong point was clear communication. But on the other hand, Massachusetts did not suffer from some of the negative aspects that other states had. Like in Florida, there's this public mindset about partying, that the government has to deal with. Massachusetts didn't have to deal with that, right? Or say in California, there's this economic pressure, like businesses want to open, and there's this huge pressure from them. Whereas in Massachusetts, perhaps it was not as, the pressure might not have been as bad. So you see, it's more like more of the good things and less of the bad things. So that might have helped them, bring things under control quick.
Yeah, I think at least economically, because a lot of their industries are based in healthcare, probably maybe not as hard hit as some of the other states in that realm, but they're also their approval rating of the governor. I think they are a lot more likely to listen to him, and that kind of infighting among states where people don't want to social distance, some people do, I don't think was as prevalent in Massachusetts.
Mm-hmm. The approval rating is a great one because that sort of falls in parallel with Sweden, right? So they had a confidence in their own population that, hey, if we just recommend people good safety measures, people are going to listen to us, right? And so they didn't need to enforce it, just recommended it, and people did comply with social distancing and masks, right? So I think this approval rating or confidence in the government or the leadership, I think that is a very interesting point here.
Just to add one thing about Florida's case, overwhelmingly, I believe the infected are youth. But there is one thing that I want to discuss is that, so from the very beginning, I believe that's, I mean, it's true that young people tend to die less or they most probably suffer less, but there are actually research to show that a good percentage of the people will suffer from long-term consequences due to the coronavirus. It may not surface now because they're young, but over the years, it will most probably haunt them. So that's even now, even people who know it well, but even now they will also say that yeah, it doesn't affect young people and so on. So I don't believe just looking at the death rate, it's obviously a tragic metric, but it should not be the only metric if you think in the long run.